The number of people in San Diego County who have tuberculosis has dramatically declined in the past 20 years, with 220 cases reported last year. Still, the highest rate of TB cases in California are in Imperial County, and in Mexico, TB rates and numbers are highest in Baja. Joining me with what's being done to control the disease are my guests, Dr. Kathleen Moser with San Diego County's Health and Human Services, and Alana Ortez with International Community Foundation. And Dr. Moser, what is tuberculosis and how do you get it?
Right, tuberculosis is a bacterial illness that primarily affects the lungs, and it's transmitted, and the reason it's a public health entity is that it's transmitted from person to person through the air.
And you could transmit it and not know you have it, correct?
Many people transmit it before they're diagnosed, and that's really how it can take hold in a community.
Who's most vulnerable for getting TB?
There's a lot of groups in our community. We have people from where TB is more common, so immigrant groups, but also the elderly, because they were kids when TB was more prevalent. So the elderly, there are people who abuse drugs, people who have forms of immunocompromise from HIV, but even people with diabetes are more at risk.
How is it treated?
It's treated with multiple antibiotics. So you start with 4 antibiotics at the same time. You take that for several months, and then the full course of treatment can be from 6 months to up to 2 years.
And is the treatment the same here in the U.S. as it is in Mexico, as it is in other countries?
Right, so the basic form of treatment is the same actually worldwide with those 4 drugs to start with.
Okay, so Alana, then what are the major challenges then in treating TB among people who live on both sides of the border or go often between Mexico and the U.S.?
So I work with a community foundation that works in the border region, and we have found that in the border region there's higher rates of a lot of illnesses because there are transient populations, because people are coming from other areas and bringing illnesses with them and spreading them. Also, we find that because there's poverty and at-risk populations for many different illnesses, that's one of the risks for tuberculosis as well.
And is it difficult to get a tuberculosis patient maybe who is in the border region to comply with treatment on both sides of the border?
Yeah, absolutely. So binational cases, what this agreement that we were celebrating in the past week is between the Imperial County, San Diego County, and the state of Baja California's health services, and our community foundation and a nonprofit called Puentes de Esperanza. And the reason we're all working together is because binational cases are very hard to treat, because there's so much movement and people aren't necessarily stable in one locale. And it really takes a lot of collaborating to work together to treat those cases.
Because I understand there's a lot of, you have to follow up on this treatment. It isn't just a one-time thing. It can take quite a while. Right. So Dr. Moser, how is this collaboration actually tracking and helping these people get treatment?
Right, so well, we're hoping the collaboration and the new agreement that we signed is going to help to strengthen and broaden the kind of strategies that we already have in place. So like you said, people go back and forth across the border. So we're hoping one of the things is that we're just going to have better communication, many partners that are making sure that people are remaining on their treatment.
And Alana, is technology helping with this? Is there some sort of way you guys share information?
Sure. I mean, using technology as simple as phone, video conferencing and teleconferencing, which is pretty simple technology, but that's really critical to get everyone communicating and talking to one another. And there is potentially in the future the opportunity to use additional technologies to help observe treatment for TB.
Well, it's important to track though, right? Isn't that one of the most important things?
Well, I mean, for the individual who has active tuberculosis, you want to be sure that they're on treatment. There are, one of the collaborations that we're hoping to broaden is actually with promotoras, that they would call them in Mexico. People actually go and watch you take your medications every day. And it's not so much they track the person, but they keep on track with the person to make sure that they're taking their medications every day. And one of the strategies, the technology, is actually we're doing a lot of studies with this in San Diego County, working with UCSD really, where we're actually having people videotape themselves taking their medications and sending it in. Oh. And now we're using, with another UCSD researcher, using ingestible sensors
That
so
makes sure that you follow up. So a little bit of...
And those can be used across the border as well.
Okay, sure. So much to talk about this. Dr. Kathleen Moser and Alana Ortez, thank you so much.
Thank you.